discussing newborn musculoskeletal system, and as nurses will be doing the assessment of this system. So when we say musculoskeletal system, it provides shape and support to the body, allows movement, protects internal organs, and produces red blood cells in the bone marrow, which we call the hematopoiesis. And this also stores calcium and phosphorus in the bones. So what would be our goal in doing this assessment of the musculoskeletal system of the newborn? First thing is, of course, to detect the risk factors, the potential problems or musculoskeletal dysfunction at an early age. And also to plan appropriate interventions, do of course the health change, the health promotions, and of course the disease prevention. This is also very much part of the nursing task. And of course to implement treatment measures if in case that we've already found out that there is problems with regards to the musculoskeletal system of the newborn. So what would be our the things that we need to assess? Of course, we need to assess the arms, the hands, and the feet, and of course the legs of the newborn. So normally, the feet and the legs should be symmetrical in size, shape, and of course the movement. And the extremity should also be warm and mobile with adequate capillary refill. So again, what is our normal capillary time? So it should be less than 2 seconds. Okay, so how are we going to check for the capillary refill time for the newborn? So in adult patient, what we're doing is we're pressing the nail bed of the fingertips of the adult patient. So in newborn, we're just pressing this one. Okay, so after pressing that one, you will check for the discoloration on how long it will take, okay, to return to the normal state. Okay, this the color of the hands of the newborn. So that one is how we check for the capillary refill time or the CRT for the newborn. And we need to check also for the pulses. And what is the specific pulses that we need to check? Of course, the radial, the brachial, the femoral, and the popliteal, and even the pedal pulses of the newborn. So those pulses should be strong and equally bilaterally. Okay? And what about the abnormal findings, if there is? The short and broad extremities, the hyperextensive joints, and palmar simian crease may indicate Down syndrome. And polydactyly, which means there is an extra digits, and the syndactyly, which is the webbing, are sometimes found in children with mental retardation. And absent femoral pulses, it indicates coarctation of the aorta. And neurovascular deficit is usually secondary to trauma. So here is the visual presentation of the polydactyly and of course the syndactyly. So as you can see, there is an extra digit. So normally we should be having only 5 digits for the hands and of course on the toes, okay, at the foot part of the newborn. So as you can see from the picture, there is an extra digit. Sometimes not only one, sometimes there are 2. Okay, and when it comes to syndactyly, this is what we call the webbing. There is no spaces in between the toes and even the fingertips of the newborn. So this one is what we call the syndactyly or the webbing. Okay. Then another thing that we need to assess from the arms is from the extremities is of course the inward or the pointing toward the center of the body, which is the positioning of the forefoot with the heel in normal straight position. So normally, but this one it resolves spontaneously. Even the tibial torsion, this consists of the twisting of the tibia, whether inward or outward in its long axis, and usually caused by the intrauterine positioning. And what about the abnormal sides of this? So if there would be a fixed position or fixed deformities, and this one could not be returned to normal position even with the simple manipulation of the ortho. And there will presence of also of the metatarsus varus, which is the inversion or turning inward that elevates the medial margin, and the adduction of the forefoot. So this is the visual presentation of that. So when we say the tibial torsion, this one is normal. Okay, that one can be corrected, but the fixed position or the fixed deformities or the true deformities is like this one. It'll be a rigid bone formation of the newborn. Okay, as you can see from the picture, and even the metatarsus varus. This one is another abnormality that you may found in the newborn. Another abnormalities that you may also be checking is the presence of the talipes varus, which is the adduction. So when we say adduction, moving, what do you call this? Moving inside is the adduction, and when we say abduction, it is outward. Okay, separation. Okay. So, adduction of the forefoot and inversion of the entire foot. And talipes equinovarus, or the club foot, is indicated if foot is fixed in the following position. The adduction of the forefoot, okay, and inversion of the entire foot. And equinus pointing downward is the position of the entire foot. In some of the newborn, when we say this one, pointing downward of the foot part of the newborn, so you can consider that one as abnormal if that one is already fixed while while the baby is walking. But sometimes if you will still observe for the newborn, if the baby can make his foot flat on the floor, so meaning that is not totally permanent. Okay, so you need to observe that one while checking for the newborn's gait. And this one is the visual presentation of the talipes varus, okay, the foot. The talipes equinovarus, which is the club foot, and equinus pointing downward, because most of the newborns and even the children, there are some who walk like this, pointing toes, okay? So, still observe for that kinds of children, because there are some that can be corrected, but if it's already fixed, that one should not be corrected. So another thing that you need to assess in the musculoskeletal system of the newborn is the congenital hip dysplasia. And this one can be performed by the ortholanus maneuver. So actually this maneuver should be only performed by the pedia-ortho, wherein the infant should be placed in a supine, flex infant's knees while holding your thumbs on mid-thigh and your fingers over the trochanter, as you can see from the picture. And while he already positioned his thumbs on that part, he will abduct the legs and moving the knees outward and downward the table. So how are we going to check for the findings? Of course, normally in performing the ortholanus maneuver, there should be an equal gluteal folds and full hip abduction, and there should be negative ortholanus sign. And with regard to the abnormal findings, there is an equal gluteal folds and limited hip abductions. So these are signs of congenital hip dysplasia. And how are we going to know that it is a positive ortholanus sign? Of course, the examiner will be hearing the clear click heard along with the feeling of the head of the femur slip in or out of the hip. So another thing that you need to assess is also, you need to check also is for the congenital hip dysplasia. So this time around, you will be performing the Barlow's maneuver. So we're done with the ortholanus maneuver. So with regards to Barlow's maneuver, so same position, but then the next procedure would be abducting the legs, okay, moving apart, okay, of the legs until thumbs touch. So the result would be, normally the findings would be negative for Barlow's sign, and when it is positive, the feeling of the head of the femur slipping out of the hip socket. So there would be an how are we going to explain this one? There is a misalignment something, or not in a correct position. There is a slipping out of there is a dislocation, slipping out of the hip socket. And another thing that we need to assess is also for the assessment for spinal alignment. So normally in newborns, the spine is flexible with convex dorsal and of course sacral curves. And in infants younger than 3 months, the spine is rounded. And when we say it, there is an abnormal findings. Of course, there is a presence of flaccid or rigid posture. Then, in older infants and children, there is an abnormal posture which suggests neuromuscular disorders such as cerebral palsy. So, if you will be examining a newborn, if you found out that from this his appearance, actually it's very much noticeable when it comes to cerebral palsy. So, that one is also part of checking the musculoskeletal system of the newborn. Another thing is assess for the newborn's joints. There should be full range of motion, and there should be no swelling, redness, or tenderness. So you need to check. Okay. Then, if in the abnormal findings, of course, there would be limited range of motion. There is the presence of swelling, redness, and tenderness. And to add also is, of course, there is a presence of pain. So the newborn will cry when checking for that one, if there should be tenderness, redness, and swelling. And a simple palpation or simple checking and touching of the parts will start the baby on crying. So this indicates that there is problems ranging from mild injuries to serious injuries. So in that case, you need to do some history taking. You need to ask the mother or the special someone or his nearest relatives on some incidents with regards to acquiring this kind of injuries. Another thing that you need to assess is the muscle. So normally the muscle size and strength should be adequate for the particular age and should be equal bilaterally. Then abnormally, there is inadequate muscle strength and size for particular age. So it indicates neuromuscular disorders such as muscular dystrophy. So in this picture, as you can see, there is in proportion. Okay, so as you can see from the picture, at the back of this child, there is in proportion with regards to his body alignment. And this one, the baby, this one is as you can see, very much weak, because normally if you will lift the child, the normal reaction would not be like that. Okay, the baby will be aroused if you will hold this like that. Okay, but this one, the examiner is handling as if the baby is not okay, is very much not okay in this picture. So in summary, the procedure in a newborn muscular assessment is musculoskeletal assessment, by the way, is first thing and foremost, you need to secure consent from the parent and explain the procedure to them. Then identify the patient. So how are we going to identify the patient, the baby? Of course, you need to check the ID band. And if he is with her mother, you need to do counter checking as well with the mother. Okay, then do the hand washing. Every now and then, in every procedure, you need to perform hand washing. Then, you need to assess the arms, hands, feet, and legs. The feet and legs must be symmetric in size, shape, and movement. And extremities should be warm and mobile with adequate capillary refill time. So, same with the cardiovascular assessment. Okay, there should be actually, when it comes to this the color of the baby, that one is also can be considered. Okay, so this one should be warm also. Then you need to check also for the pulses, radial, brachial, femoral, popliteal, and of course the pedal pulses, and this should be strong and equal bilaterally. Assessed also for the polydactyly and the sesindactyly. And for the presence of the Talipes varus, Talipes equinovarus, that should also be observed in the newborn or should be inspected as well. And assess for congenital hip dysplasia by performing the ortholanus maneuver and the Barlow's maneuver. Again, the one who will be performing this kind of the maneuver is the pedio ortho And that one, if she'll be performing that maneuver, as nurses, we will be the one assisting the doctor. Then assess for the spinal alignment, assess for the muscles and joint. Then after thorough assessment of the newborn's musculoskeletal system, you may now do your complete documentation. Okay? So by the way, I'm expecting this the return demonstration of the musculoskeletal system assessment. Your due date would be on May 13. Okay, so there's no video with regards to musculoskeletal assessment because the procedure will be the same thing with the head to toe assessment. But the thing is, you will not be doing the head to toe assessment, but you will be focusing more on the musculoskeletal system. So you will be discussing the different things that we've discussed in this PowerPoint presentation. Okay, so focus more on the musculoskeletal assessment of the newborn by, of course, with a guide of the procedure of the newborn head to toe assessment. So thank you very much and hope to see you by next week. Goodbye.